welcome back here. Some staggering statistics this morning to share with you when it comes to our mental health. Did you know 25% of adults and 20% of kids will be diagnosed with mental illness in their lifetime? And getting help early can make a big difference. A leader in the field of child and adolescent psychiatry, Dr. Tarshis, joins us this morning to share the healthy habits and treatments that kind of help alleviate the suffering that comes with mental illness. Thanks so much for being here, Doctor.
Thank you so much for having me.
Look, we know mental illness can be ignored. It can go undiagnosed, right? So what have you experienced when children and teenagers have access to these crucial therapies and treatments?
Yeah, well, just like every field in medicine, the earlier you get treatment or just getting the right prevention techniques does so much in keeping people healthy. And the same is true in psychiatry. So unfortunately, it's been a very underserved area, but the goal of the clinics that we started was to try to get in there at the youngest age when it's so much easier to get kids and young adults treated and doing better.
We just put up the website BACA.org, B-A-C-A. Can you tell us what that organization is and how it is helping?
Yeah, so I started BACA about 14 years ago up in Northern California, really trying to bring together best practice treatments in the field of mental health, which unfortunately, again, is way behind other fields of medicine. So what we do at BACA is bring together a multidisciplinary team of professionals working in a collaborative nature and try to be a one-stop shop for families that can get all the treatment they need at our site.
And Doctor, we have a little, I guess, positive breaking news to tell our viewers here, right? You're going to be expanding BACA here to San Diego, right?
That's correct. So we've been looking at coming down to San Diego for a couple of years, and we found a great doctor graduating from UC San Diego, Tyler Morrison, and we're excited to bring our skill and expertise to the San Diego area this fall.
That's great, and I know the details on where, the location, all that is still being worked out, but it's just good to know that that's another great resource we're going to have here. Let's talk about COVID, the impact on children's mental health care. I would imagine there have been a lot more patients and a lot more kids going through so much this past year.
Very, very true. And it's already been desperate. And any family that's tried to pick up the phone and make an appointment to get help for their teen or any young adults who've tried this on their own know it's very difficult to get care. And what's happened with COVID is the number of people requesting services has literally doubled. So now where there was maybe 100 families trying to get in every week, there's 200 families. And unfortunately, even though we do everything we can to expand, there's a lot of barriers to getting services in place, and it's a desperate time for our youth.
What are some of the issues these people are facing? What are some of the concerns they have?
Yeah, so mainly depression and anxiety, which are already the two biggest mental health issues that we treat. Those have been getting much, much worse during COVID. We're seeing a lot more teens and young adults with suicidal thoughts, a lot of people that are very desperate for getting any level of services. And it's heartbreaking to see the number of families desperate for care in California and throughout the country as well.
I know at BACA you guys do some of these teen therapy, these groups, teen therapy groups, and you guys are utilizing things like Minecraft and Dungeons and Dragons to kind of be able to have this conversation, right? How does that all work, and how does that help?
Yeah, so we you know, when you're working with youth, you've got to be fun and innovative, and whenever we have an idea for a new treatment that might help kids or youth, we're the type of agency that will put together a program and let's run it and study it. And anything that you can do to creatively engage youth, both from our young adult population and for our teens and younger kids, that's stuff that we get excited about, and we're always looking for innovative things to engage kids in treatment.
We got to run, Doctor, but real quick, if someone watching this that realizes, look, you know, it's time for me to get some help, or time for my kid or my teenager to get that help, where should they go to learn more?
Yeah, so I actually like to push families on advocacy, and that, you know, everyone has a right to get seen within a couple of weeks for mental health care. So if you can't get an appointment for your child or yourself in a couple of weeks, actually look to the state to help provide resources for how you can push on that issue.
All right, Doctor, thanks so much for joining us here this morning. Sure appreciate your time. Such an important
Thank you
conversation.
for having me.
Thanks for being a part of it. A lot of kids going through a lot of parents, a lot of us are going through a lot,
course,
right? And you
yes.
gotta, the first step is looking for that help because
Yeah.
it's out there. There's some great resources.
There's great people just like him that were talking
Yes.
about it, so it's available.